not a pertinent thing to tell a patient that they may expect to have, that they could possibly get something that happens in 1 out of every 100,000 patients. There's no purpose in that. And the fact is, so much medication and therapy is psychological that, believe me, if we told every patient all the things that they could experience, they would experience it.
I think that sometimes it can be very difficult to balance putting out these warnings while at the same time not scaring people and putting people at higher risk because they're being left without treatment. So I think it's a difficult decision, and sometimes it's tough being in their shoes.
Again, we did it.
Side effects of medication, things like that, are discussed if they're relevant, okay? And the patient can certainly be given a description of all the possible side effects since they're right, whatever. The liver is the main way to detoxify these things. And really, it's not, if a medication's taken that has a high risk of causing liver toxicity, like I said before, that will be monitored. The patient will be told to come back monthly, and they'll check the results of the blood tests. And you know, if the liver enzymes are going up and they see potential liver problems, they're going to stop prescribing the medication. Okay?
What if they need it?
Well, then you go to something else. Okay? That's, you know, and hopefully it won't be as toxic to the liver. But would you prescribe liver tests for every patient that takes drugs? No, you wouldn't do that, because that would be counterproductive to the health system and the health dollars. The money's not there.
Abruptly stopping some of these medications can lead to the emergence of serious side effects. So sometimes it needs to be done very slowly, but absolutely it needs to be done in consultation with their doctor.
So there's the potential of side effects, but while taking the medication, potential of side effects while not taking the medication.
Yes, that's right. One of the things about these medications is that the antidepressant effects, the beneficial effects, take time to develop. They take about 2 to 4 weeks to start working. The side effects, on the other hand, start right away. So that initial period when people are experiencing the side effects, but not yet the antidepressant effects, can be a difficult time. And I think that that's part of the reason why the FDA recommended close monitoring during that initial period.
I mean, if I told you, if you were very sick, okay, very, very sick, and you looked at an antibiotic, some antibiotic's going to, you know, definitely relieve your symptoms. And if you looked at all the side effects yourself and decided that you weren't going to take that medication because of all the things that could possibly happen, even though they're very rare, would that be a good thing for you? Or would it be better to take the antibiotic? I mean, what would happen if you didn't take the antibiotic for this sickness? You know, it could possibly kill you. So there's the risk reward, you know, in your lab.